Hey guys, it's Dr. Anthony Davis at the Davis Medical Group, Body Goal MD, and the Spot Body Goal. Today we're going to talk about, I think, the real pandemic, and that's the diagnosis of diabetes and pre-diabetes, what I like to call carbohydrate poisoning. Please like, subscribe, share this video, particularly with anyone who has diabetes. I think this is important. Some people feel like they can't get rid of it, that they're born with it, that it's genetic. I'd like to share some thoughts on that may change your mind. So, seriously, diabetes, don't we all know what that is? You know, you're born, at some point in your life, you're given this disease by genetics, and then you take medicine for it, and we control that, and some people have to go on insulin. You know, it's just part of a normal life, right? No, it's not a part of a normal life. Do you know that most people give themselves diabetes with their lifestyle? Therefore, I think most people can turn diabetes back off and cure themselves. 10% of the American population in 2015 had diabetes. I want to pause there. 1 out of 10 people had diabetes. Imagine if 1 out of 10 people wore a red shirt. How many red shirts would that be? Oh my goodness, this is such a huge problem. I don't like this at all. And 89, almost 90 million people are pre-diabetic. So let's define that. What does diabetic mean? Diabetic means on a lab test that your hemoglobin A1C, which is a 3-month sugar average, basically how sweet are the red blood cells that have been marinating in your blood. They die every 120 days, and so we use that number. Anything over 6.5 is considered diabetes. And how does that translate on a blood test? If you pop your finger and you have not eaten, that's 126 or above. But we go with the A1C. Pre-diabetes is anything from 5.7 up to 6.4. So the majority of people have a blood sugar problem in this country. Many other countries don't use 100. They use 85 as a normal sugar. We get a fudge in there because we're America, right? Of course we're worse off than they are. We have more food than they are. Of course we're worse off. We're richer. We have more stuff. That should not give us a pass, but it does. I hear this a lot. I come from a big family, therefore I'm big. I come from a family of diabetics, therefore I have diabetes. I come from this, I come from that. Well, no, you're following the same patterns that they're following. You're eating the same foods that you were taught to eat by the same people who have those diseases, therefore you have that problem. If you came from a family of very healthy people, more likely than not, you're going to choose healthy things. And as a parent and a grandparent, maybe it's up to you to start setting an example of what healthy people do. That's kind of the goal here. So I think it's changing your belief system and not believing that you have to have the diseases that you think you're supposed to have because of your genetics. Genetics play a big role, including diabetes, but that just means you have to fight harder. And frankly, we got to get this problem under control. So what is diabetes? There's 2 types of diabetes. Quickly, I'm going to talk about type 1 because that's not an important topic for us in this video. Type 1, your pancreas doesn't make insulin, therefore you die. You take insulin, enough to keep your sugars moving into your body, and you do fine. Type 1 diabetes is not what we're talking about. We're talking about type 2 diabetes, or also called adult onset diabetes. And so we're talking about diabetes that has become acquired over time. So how do you acquire it? You make too much insulin over and over and over again, and eventually your body becomes resistant to that insulin, and the sugar can't get out of the blood vessel. So I tell people this all the time, and it kind of blows your mind. In fact, it's kind of hard to say it to get it just right. A diabetic whose blood sugar is too high has way too little body sugar. So if you take somebody with diabetes and put them up next to somebody without diabetes, the diabetic person who you think has too much sugar has too little sugar. Their engines, imagine this, you have a whole car lot full of cars and you have a line of tanker trucks full of fuel. In a diabetic, every car is out of gas. And all of the fuel is stuck in the tanker trucks. It can't go from the tanker truck through the hose and get into the gas tanks of those cars. So every car is running on empty or dying. Well, what are those cars? Those are your brain cells, your eye cells, your kidney cells, your body cells. What does insulin do? Insulin transmits the sugar from the blood vessel into the fuel tanks of the cells. Okay, that's great. Well, what happens if you release too much insulin over time? All of those mechanisms become resistant. They don't work anymore. So the fuel gets trapped in the tanker trucks and cannot make it into the gas tanks of the vehicles. So none of your vehicles work. What are the big things that we're after in the clinic to try to prevent? Blindness. Well, there's not enough blood vessels going into there, not enough blood going to the eye, so the eye keeps making more blood vessels trying to fix the problem, and it covers up the retina like this, and you can no longer see anymore. That's called diabetic retinopathy. So the eye doctor can go in there and laser some of those blood vessels to try to clear up your vision, but you're still going to have problems. So blindness, diabetic retinopathy, too many blood vessels growing over the retina, is a big problem. Number 2, kidney damage. What does your body do with all that sugar? It tries to dump it into the urine, and all that pressure inside the kidneys. There's like window screens in there with all this pressure pushing on them. The kidneys become damaged, and you get diabetic nephropathy, kidney damage, and you wind up on dialysis. So you lose your eyes, you lose your kidneys. And how many people know a diabetic who's lost a leg, right? Poor blood flow to those extremities. The nerve endings die. You don't know you have a splinter. You don't know you have a sore. You don't know. And then by the time you know, you have a gangrenous leg and you lose it, or a finger, or whatever. And guess what? Lifestyle changes don't go into play, and medicines do not solve the problem. Insulin does not solve the problem. You can give somebody insulin and keep their blood sugar to a certain level, and they continue to develop nephropathy, retinopathy, and gangrene. Why? What is the only cells that respond to insulin when none of the other cells are responding to insulin? Let's guess. If I give somebody insulin, they get fat and their blood sugar goes down. Where did the sugar go? Where do you think it went? I think of it this way. The brain is hard to get into, so it's like a bank. It's got a vault door. That insulin stops working on that. The rest of the body, the muscles and everything else, they have a deadbolt. So insulin stops working on that. The fat cells are like Walmart. They have huge doors that never lock. So when you take insulin, the fat cell doors throw open and all the sugar runs into the fat cell. And we all high five. Hey, your blood sugars are looking great. You weigh an extra 10 or 15 pounds since the last time you were here, but your blood sugars look great. We haven't done you any favors at all. We haven't solved your problems. Modern day diabetes medicines don't do that. They work on other pathways. You know what happens when the brain is starving? It only runs on sugar, by the way. It's not getting any. Insulin won't work to get it in there. What does the brain do? The brain panics. The brain sends out emergency bat phone calls that says, hurry, eat more sugar. Hurry, you're going to die. You better eat more sugar. So diabetics are always hungry. People on insulin are always hungry for sugar. What else does it do? It picks up another phone and it calls the liver. It says, make more sugar, make more sugar. You create more sugar. It goes to the intestines. Absorb more sugar, absorb more sugar. And what happens? The end result? The blood sugar goes up and the fat cells are wide open. So you get fatter and fatter and fatter because your disease process is not being treated properly. You have a disease state of too much insulin from the food that you're choosing to eat. And we give you insulin to make it worse. I haven't prescribed insulin in so long I can't remember because it's the worst thing I can do. I don't feel better controlling your blood sugars if that's all I'm doing. If I can't get you controlled and I can't convince you to buy into what I'm trying to get you to do with your diet, we're going to have a lot of trouble. You know, it's hard. I'm a regular medicine doctor. I've been practicing for over 20 years. I know how to give insulin. I know how to give diabetes medicines. I know what I'm doing, but I got to get you to buy in to changing your lifestyle. If I can get that passion in you that you can fix this, I have seen it over and over and over again. You can fix it or at least get it to where it's much easier to control and insulin's not even on the table anymore. All right, so you come to my practice and what am I going to say to you? You're diabetic. Your blood sugar, you're pre-diabetic. I'm going to say that most often. I'm going to say that all the time. You know, I have a ton of my patients. Our blood sugars, there's a struggle with the blood sugars. Maybe it's 101, 102. Remember, 126 is diabetes, 100 is normal. So any of that I call it a ladder, the rungs of 101, 102, all the way up to 127, those are the rungs of that pre-diabetes. How do I get you to climb down the ladder? You got to stop eating foods that release insulin. You have to stop eating foods that release insulin. What are those? Basically, if you're going to just start out of the blue, you're going to give up sugar and flour. So flour and sugar. I mean, it's a no-brainer. You got to quit drinking your sugar. You got to quit eating your sugar. Flour is a sugar. It's a processed carbohydrate. Processed carbohydrates literally come in your body, into your mouth, and as they're entering your mouth, they immediately absorb into your bloodstream, and your blood sugar shoots up. What is your blood sugar? What happens when that happens? Insulin. It's the magic hormone. And what happens if you snuck up behind somebody, stuck an insulin syringe in their neck, and gave them a shot of insulin? What would happen to them? They would fall to the ground. Their blood sugar would go to nothing. I mean, like that. Instantly. Maybe within 5 minutes. So when you eat those foods, you literally just gave yourself a shot of insulin. What does insulin do? It sends the blood sugar into the tissue. Why? Because that's a signal to store fat. So your fat cells vacuum it up. Your blood sugar has crashed. Your brain panics. Your brain sends out adrenaline and cortisol to make you desperately hungry for sugar. Now you can't control yourself. You're living this state of pre-diabetes, and then you release more insulin, more insulin, more insulin, more insulin. Insulin goes up and up and up and up and up and up. It's like the boy who cried wolf, 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 wolf. Eventually, all the receptors for insulin just burn out. So initially what happens, your blood sugar goes up and then it crashes. Your blood sugar goes up and it crashes. You come in here and maybe a doctor who's not processing this correctly says you have low blood sugar. Be careful. If your blood sugar bottoms out on you, eat something sweet. Get a little piece of candy. It'll raise your blood sugar. Whoa, 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 whoa. You have low blood sugar because you're eating sugar. You have low blood sugar because the foods that you ate caused your blood sugar to spike. You released insulin. Your blood sugar crashed. Reactive hypoglycemia, low blood sugar reacting to what you eat, is a sign of prediabetes, and you're on the downhill path to diabetes. Jump off the train, please. Jump off the train. I need you off that diabetic train. Go, run the other way. If, I guess this is a little radical, but if you were going to raise a little superhuman and you were going to make it, you want it to be a genius, gladiator, super smart, super strong, you would give it water, salt, and ribeyes. That's it. That's all you need. Fat for fuel, food for meat for nutrients, water for hydration, and salt for salt. That's all you would need. Obviously, that's not the diet that I'm recommending, but I'm telling you, that's all you need. It's only when you add foods in there that are going to release insulin that you start hurting yourself. You start hurting yourself. What are those foods? Okay, here's quick. Flour, sugar, potatoes, rice, fruit, honey. Yeah, I said fruit and honey. Watch my other video before about fasting and fruit and honey. If you are a performance athlete and you eat for your training, eat whatever you want. I'm not talking to you. Where's that camera? I'm not talking to you. I'm talking to you sitting at home, not eating properly, gaining weight, not feeling your best. Maybe you're pre-diabetic. I'm talking to you. Stop eating flour, sugar, potatoes, rice, fruit, honey. I've gotten to the point where there's too many things you shouldn't eat. Let me tell you what I think you should eat. Are there other healthy diets? Yes. But this is what you do in a pinch. In a modern world that you can do day to day to day. What do you eat? Animals. There's no insulin from that, really. Unless you eat mountains of it. Animal products, let's say eggs, cream, butter, unprocessed foods. Above the ground vegetables. Above the ground vegetables. Complex carbohydrates, they don't release insulin. And below the ground foods that are keto friendly. Now this is not a keto diet, but they've done all the work for us. If you eat a radish or a turnip or a parsnip, okay, there's no sugar coming from that. Potatoes and sweet potatoes will kill you if you're pre-diabetic or diabetic, or if you're headed down that path. Do they have positive nutrient qualities? Yes. Don't argue with me that the sweet potatoes are good for you or not. That's not what I'm saying. I'm saying if you're diabetic or pre-diabetic, you better steer clear. You better learn how to eat meat and vegetables. Full fat foods are always okay. Avocados, olives, full fat foods, dairy, like cream or butter, always fine, because they don't release insulin. This is about insulin. The diabetes shouldn't be called what it is. It should be called insulin disease or carbohydrate poisoning. So we're going to get you to the point where we're going to get this fixed. So eat meat, animal products, above the ground vegetables, or full fat foods. And guess what? No more medicine. There's 3 phases, I believe, in a practitioner's life. Phase 1. You don't know what the medicines are, and you barely can identify the diseases. So you spend the first, 7 years of being a doctor making sure your patients are on all the right medicines. You got to desperately figure out how many medicines they need and get them on all the medicines. I remember being taught in medical school, a diabetic's going to be on 5 medicines. You need something for cholesterol, and something for sugar, and something else for sugar, and something for blood pressure, and something else for blood pressure. You're going to have 5 medicines. Oh yeah, and an aspirin. Don't forget an aspirin. And so you learn about what medicines you're going to put them on. And then I think you go through a second phase of your medical career, maybe the second 7 years, where you're just maintaining that. You're really good. You got everybody on the protocols they need to be on. You're doing great. They're on the right medicines. Every time you see them, you make sure the medicines are dosed right. You make sure they're taking their medicines. Everything's about their medicines, and everything's good. And then I think you get a little bit frustrated, and you spend the next, hopefully, 25 years of your practice getting rid of medicines. How do you get rid of medicines? You get people to buy in to changing their lifestyle. Stop eating crap. Start eating foods that are unprocessed and full of healthy fat, and get your body going in the right direction. Get your insulin down, lose weight, be healthy, feel good. I got to get that. And so then I spend the third phase of my career getting rid of medicines, but I got to get to the knowledge and the power and empower you. So we're going to call it an empowerment model. You're going to learn what I learned about this and get into this groove of feeding yourself the food that's going to make you healthier. Healthier. Less medicine. So we spend the first 7 years figuring out how to treat your sicknesses and identify your sicknesses. And we spend the next 7 years treating your sicknesses and practicing what I would call sick care. And then we spend the next however many years as a physician, if you care enough, practicing health care. You get healthy enough where you get rid of medicines. You get healthy enough where you're controlling your diseases that are caused by your lifestyle and your culture with lifestyle and change. Believing that you can do it. So, I hope this isn't too long, but it's really important that diabetes gets the share that it needs. Did you know that if you're diabetic, you have an 80% increased risk of stroke or heart attack? Stroke or heart attack is the #1 killer. And with diabetes, you have an 80% risk. Stroke and heart attack is not a disease of cholesterol. It's a disease of insulin. You block your arteries, pushing all the sugar through the artery wall. And the cholesterol and fat tries to go through too, and it gets stuck as well. And your arteries go, and you block them off. The #1 killer, amplified by 80%, and people with diabetes, which is just a name for elevated blood sugars because of insulin resistance. You can fix this. You can fix it. Come see me. I'll help you. We here at the Davis Medical Group know how to help you with this. It's my passion. I'm probably barely on the screen because I'm up on my soapbox right now talking about diabetes and blood sugar and eating better. But oh my God, I'm so hungry to get people off of diabetes medicines. All right. Got to put an end to this somewhere. I'll keep talking about diabetes forever. Come see us at the Davis Medical Group. We'll be happy to take care of you. I hope you watch this to the end because there's a lot of good stuff in here. Have a great day. Thank you.